Hi, I am Dr. M.R. Pujari. I am dental surgeon as well as implant specialist at iSmile group of dental clinics, Bengaluru, Karnataka. It is very common to have a mild to moderate pain after root canal because it is actually a procedure done to remove the infection. So, slight inflammation is common. So, it is common to have a pain mild to moderate after root canal, which normally stays for 2 to 3 days, and it can be controlled with the medication prescribed by the dentist. So, the success of the root canal actually depends completely on the patient. If you are going to the dentist at an early stage when you have food accumulation, a void in the tooth or a bigger hole in the tooth, which is basically a tooth decay, we call as cavity. Doctor can treat it properly. There are very less chances of infection. So, the success rate of your tooth becomes almost double, or you can say even lifetime when it is done with the capping. But when you go to the dentist at a later stage when half the tooth is broken or lot of infection which you took self medication and you prolonged your dental treatment, in such cases no doubt doctor will do root canal treatment, but the success rate of the root canal gets compromised. So, more the infection, less the life of the tooth. So, the root canal treatment success completely depends upon how early the patient visits dentist. So, always it is better to go early, much before the pain. So, if you go with the infection, yes, root canal treatment doctor will do, it can sustain for 5 to 10 years, but it won't come lifetime. Sometimes patients come to dentist with the tooth pain. It's not always there will be a cavity. Sometimes there could be a possibility of the fracture of the tooth. Fracture happens when you are eating little very hard food, especially in the non-veg, you can say the bone crushing, or even you are having food, some small stones came and suddenly it can result in a cracked tooth. So, in cracked tooth normally the tooth becomes very tender, even you can't able to bite soft diet with that. So, we all call that as a cracked tooth syndrome also. If the fracture is on the top, normally we do root canal treatment, but if the fracture is extending up to the roots, we extract the tooth. So, yes, when a tooth is cracked, there is high chances of getting pain, as well as sometimes when the doctors do filling, and if the filling is at a higher level, if it is not reduced properly to the tooth structure, that time also patient can get pain, which normally corrected by visiting the dentist. They can reduce the height of the filling, then the pain will disappear. So, as we discussed, after the root canal, having pain for 2 to 3 days is common, which is normally managed with the antibiotics and the painkiller given by the doctor. But sometimes if some amount of infection can persist, because doctors depend on X-rays and the bacteria are often invisible. So, there is high chances that if some infection remains, or sometimes a complicated root canal like a calcified canal and all, there is a possibility of having pain after the root canal. In that case, the patient, if the pain persists for more than 1 week, the patient should normally visit the dentist and seek dentist advice.